Thank you to the Wolfeboro Lions Club for underwriting Nutritional Wisdom. The Wolfeboro Lions Club is committed to helping the community with health concerns such as diabetes prevention and preservation of sight and hearing. The Wolfeboro Lions Club meets on the second and fourth Tuesday of the month in the 1812 room at the Wolfeboro Inn. Members of the community are encouraged to attend meetings or visit the website e-clubhouse.org/sites/Wolfeboro for more information.
Hi, it's Patty Walker, registered dietitian and certified diabetes educator, and your host of Nutritional Wisdom. Today will be the fifth in a series of interactive diabetes classes. I am using the materials from the Diabetes Conversation Map, which are the same used in many certified diabetes programs. My goal is to provide you with the necessary information you need to manage your diabetes from the comfort of your home. Since these classes work best with interaction, I invite some people from the community to be a part of the series. So today I am very pleased to invite and welcome Michelle and Dawn.
Hi, good to be here.
Thanks for having us.
Oh, you're welcome. I really appreciate it. Believe me, we couldn't do it without you, so so glad you're here. In episode 4, we reviewed blood sugar goals, the barrier to testing, and how to test your blood sugars at home. In today's episode, we're going to continue in the same vein, discussing how monitoring can help you improve your control, the best times to test, and exactly what those blood sugars are telling you and what the A1C test is. Then we're going to review some sample blood sugar numbers, and we're going to see how well you guys can help interpret what those mean. How does that sound?
How exciting.
It's a test.
It's a test, exactly. That's what
Stress.
people
I
hate.
feel my blood going up. It's a stress.
Yeah, it's only a test. No, it's only a number. It's only a number. Forget it's a test. But that is a true statement. So many clients, they feel it's a judgment on them, and it's a test. You know, I flunked it. I stopped testing my blood sugars because they're always bad. And it's like, it's not good or bad. It's a number.
Yep.
We're going to be using the same conversation map that we used the last time. It does have the hot air balloons on it. So the map does compare blood sugar to a hot air balloon ride. There's always going to be ups and downs, but it's best to have a steady and even flight. This means keeping your blood sugars in target range. All right, Michelle, I'm going to ask you to read the information written on the chalkboard.
Okay. Monitoring. Monitoring gives you information about your blood glucose levels. You can use results to help you make decisions about the activity and your medication.
Yep, and meals too, yeah. So testing will give you the information you need to make decisions to keep your blood glucose in range. So let's look at the times to test, because that's going to give you some good feedback. We're going to look at the yellow balloon on the top of the map there. Dawn, can you read the information that's written on that yellow balloon?
Sure. Options for monitoring. Fasting before meals, 2 hours after meals, at bedtime. Talk to your healthcare team about when you should monitor.
Well, to me that makes sense, because not everyone has to monitor it all those times, but it should be very individualized as far as when you test. Some people will test all 7 times that you just said, and other people may test once or twice a week, and other people may test at various times, really depending on what their goals are, their medications that they're taking, and how often they want to test. Some people don't want to test at all, and that's a legitimate concern, and it's something that we deal with. Do you or loved ones test blood sugars at home currently? And if so, how often are you testing?
My mom tests morning, noon, and night before all meals.
Okay, before meals.
Other family members, they test once per day. Sometimes maybe it'll be like a morning and then the next evening.
Okay.
So
anyone test 2 hours after a meal?
I don't know.
Okay.
I know my husband doesn't.
Okay. I'm going to say, in diabetes and in pre-diabetes, the first blood sugar that goes up is the after meal blood sugar. So testing 2 hours after a meal is a great indication of how well your blood sugars are, how well they are.
Okay.
I mean, you want them to be under 140 2 hours after a meal, or that's the American Academy of Clinical Endocrinologists goal if you're in pretty good range, and otherwise under 180, because chronic blood sugars over 200 is where the long-term complications happen, and the blood sugar is going to be highest after a meal.
Okay.
So I often recommend to my clients to test before and after the same meal. So let's say they say, let's test, doctor says test once a day. I'm going to suggest initially that they test twice every other day. So at the end of 14 days, they still use 14 strips, but they get before and after breakfast.
Yep.
Or before and after dinner. So before and after your largest meal, which tends to be supper. So that one will let you know how your blood sugar did throughout the day, your pre-supper meal, and then how your body handles what you ate and the amount of carbohydrates for the post-meal.
Okay.
And then the fasting one lets your body know what you did, what's happening overnight with your blood sugars. That one's more affected by your liver and glycogen breakdown. And then again, 2 hours afterwards. So ideally, they're not more than 50 points apart. So
Really?
So
Wow.
if you have a blood sugar of 100 before a meal, you don't want it higher than 150 2 hours after a meal.
Okay.
I have some clients, blood sugar is 130 before the meal, and it's 100 after the meals. And they're like, is that normal? And I'm like, yeah, because, activity, other things, you didn't overeat your carbohydrates, you probably had some medication and activity, so things are kicking into place. So it's not uncommon that fasting blood sugars are the highest blood sugar of the day for many
Wow.
persons with diabetes.
Okay.
Yeah, so Dawn, tell us about the A1C and why you're using that as a test.
Well, I did use the blood tests for 3 or 4 years probably.
Yeah.
But then when I got down to, I started off at 7.1.
The A1C is 7.1.
And I got down to 5.8.
Yeah.
And 5.8 to 6.1 basically.
Yeah, pre-diabetic
So
range.
I decided that there wasn't really a big reason for me to test on a daily basis and relying on it. But I just recently got a new blood pressure,
Glucose,
a new glucose
a glucometer,
tester.
yeah.
And also, since I stopped doing the glucose testing, I started on metformin.
Yes.
So when you mentioned that after dinner your blood sugars would be higher, but the metformin puts a damper on that, right?
It does help the sugars get into the cells a little bit, but metformin's biggest role is to tell the liver not to break down sugar.
Oh, okay.
So it
Yeah.
doesn't really help. There are
right.
certain categories of medicine that absolutely will help the sugars get into the cells, but metformin isn't one of the main ones. Yeah.
So in deciding when I'm going to test myself now, one of the things that you just said was that the metformin works, say, in the morning probably better.
It works overnight. It helps
Yeah,
your
right,
liver not break
overnight.
down so much sugar.
So in the
Yes.
morning, I like you had high glucose levels for some reason, or because I exercise in the morning. I'm not sure,
Yeah.
but I could take a blood test as soon as I get up in the morning.
Yep.
And see what that looks like.
Yep, that's a really good indication of how well metformin works. It's one
Okay,
of my favorite
right.
times to test.
And then I could take it before and after dinner.
Yeah, but you can, because your A1C is so good, you're a perfect example of someone spot checking once or twice a week. You don't have to test it daily. We just want to make sure that we're not missing anything.
Right.
Yeah. Yeah.
Okay.
So A1C or glucometer are great ways to test your blood sugars and keep track of them. So if you use a glucometer, how do you keep track of the results? Do you remember what you did before?
Oh, yeah. I mean, there was a little a pad, like a checkbook thing. And you'd write in the AM, the PM, all of them. So, and then I would take that to the doctor and show
Great.
the doctor.
Yeah.
Yep.
Does your
So-
family members do
Yes.
the same thing? They write them down and they bring them to the doctors?
Yes, and actually there's a calendar, and we actually look at, he's on a new medication, Ozempic, and we look to see what is happening after that Ozempic shot. So
Nice. Yeah.
Yeah.
So I was going to say, do you learn anything by monitoring?
Oh,
absolutely.
yeah.
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 That's great. Yeah. Because again, it's a number. It's not it. I mean, we call it a blood sugar test, but we should really call it blood sugar monitoring. And so if it's high, we're actually gonna do some practice ones a little later, as far as if these are your blood sugars, what you could do. So yeah. And what would you say the benefits of monitoring are?
Well, if you're feeling a certain way, you get to see what the reason is. One, and you get to know how you're doing.
Yeah.
And your doctor gets to know. Your healthcare team gets to know.
And since I don't have any way to know that I have
You don't
the
have no
disease,
symptoms, right?
yes, so it's a good way for me to see if there's certain times when it's way high, or
Yeah.
See
Yeah.
patterns.
so yeah.
Yeah, you see the patterns. And another thing that I really like to encourage is, so the monitoring is kind of like a snapshot, where you've taken a snapshot in time. This is what your blood sugar is in the here, now, in the moment. And the A1C is kind of like a 3-month movie film, or you've just watched an hour, 2-hour movie. So they should correlate, but sometimes they don't. I think I'd mentioned before, I've had clients that blood sugars are in their 40s and in their 400s, but their A1C looks normal. Because it's an average, and those aren't good blood sugars, because the poor person is on this roller coaster of blood sugars, feeling high, feeling low, sweating, being hungry, having blurred visions, feeling miserable all the time. So it's very, very helpful, even if you don't know what to do with the blood sugars, to still write them down and share them with your healthcare team, because we can help you. We can help identify, interpret, and teach you so that you know what to do going forward. So please don't be afraid of it. And what about support from family? How do they respond, and how would you like them to respond?
My wife is a very good cook, and so I have a lot of good food. So she provides me, but I control what I eat.
And how about, did your family members appreciate that you're there to help with low blood sugars or high blood sugars? And
Absolutely, and I've backed off a little bit on the you can't eat that, or you want to make another guess on that one, or you want to take, so I backed off. They can make their own decisions, and we'll kind of deal with that as it goes. So
I know.
I'm being more supportive as opposed to being the neg.
That's awesome. I get it. I don't have diabetes myself, but I can empathize that it's a difficult condition to manage at times, and the best thing that they're looking for is support and help from others. But sometimes tough love is necessary. You don't want them to do a downward spiral either. So it's a tightrope walk in many cases.
And I do think that there's not enough people know the long-term issues that this can cause. There's there's some long-term issues that.
Right, and they're silent.
Silent.
That's what's so frustrating. I mean, blindness and kidney disease, you don't have symptoms until it's too late. So it's super important. And again, one of our future shows is going to be about what those long-term complications are and what you can do to prevent them. So, I mean, that's our goal. That's the Lions Club's goal. We want to reduce the incidence of diabetes, but we also want to prevent the long-term complications and improve the quality of life of persons with diabetes. Because some people, when they get that diagnosis, they do say it's the best thing that happened to them, because they can stop the downward spiral of the lifestyle choices that they've been making, make some positive changes, and it does make a big difference. All right. Well, Another measure to test of treatment is the A1C. So we're actually going to look at the A1C because I don't think we've really talked in depth about what exactly the A1C is. And so we're going to give Dawn this privilege to read the purple balloon, I guess it's a red balloon, entitled Knowing Your A1C, so that we can explain what an A1C is and what are the
Okay.
benefits of it. So Dawn, what does the red balloon say?
Okay, so knowing your A1C. A1C is an average of your blood glucose levels over the past 2 to 3 months. Your A1C level should be measured every 3 to 6 months. Then there is a chart of different A1C levels and what the average blood sugar is.
Yeah, so on the balloon you'll see the different charts. I mean, you'll see what 7% is equal to about 150. So you'll see all that on the chart there. And so because people don't understand what that means, but again, as I said earlier, my client who had blood sugars in the 40s and in the 400s, her A1C was 7. So she goes to her doctor, so doctor looks at her A1C and says, great work, keep up the good job, or keep up great job, keep up the good work. And she's like, she comes to my office in tears because she feels so horrible. And I said, well, did you show the log book? They were too busy. So we have to be prepared when we go to the doctor's office. They're there to help us. All PCPs, they're there to make us as healthy as they can help us. And so I'm not blaming the physician, but we also have to be a little pushy going, I know my A1C is 7, but my blood sugars are 40 to 400 and something's wrong.
And you have to advocate for yourself.
You do. Yep. And
Or
if-
your loved one.
Yep, I was going to say, and if you can't advocate for yourself, then bring a loved one
Yes.
or a friend that can advocate for you. Very important. So the average A1C is a 3 to 6 month look back. Does that make sense? So do you know anything about the A1C, Michelle, and how would you summarize what it is?
I'm not quite certain. I know it's a test that's taken, it's a blood test that's taken, and that's how they measure. Not sure how they gather that information from one blood test, but they do.
Yeah.
And it's a great test. It's a test that we in my family we look at as kind of a goal. Let's make sure the A1C is down to this point or this point, and let's bring it down 3 points. And so it's a very good test that we use. In my family.
So it's a great test, and I love it because you don't have to fast for it.
Yeah.
In today's busy world, it's hard to get fasting blood work. It is the gold standard, but some tests you don't need fasting blood work. So you literally could walk into your doctor's office, I'm not recommending this, drinking a bottle of Coke and having a donut or a Pop-Tart in your hand, have your A1C test, and what you just ate and drank is not going to be reflected in that A1C test. The reason is that glucose, which is blood sugar, attaches to hemoglobin in the bloodstream. Hemoglobin cells are 60 to 90 days old. So the test is
They live
literally
60
to 90 days. After 60 days, some of them start like disintegrating, falling apart. But new ones are always rebuilt. So glucose attaches to the new ones. And so it's an indirect measurement of your blood glucose. And what a lot of people don't know is the majority of hemoglobin cells are on the younger side. They're about 50% of them are about 30 days old. A third of them are between 30 and 60 days old, and the rest are the older ones, the old, strong, mature ones. Well, if you're having an A1C test done, you have a window of opportunity the month before, because what you do the month before has the biggest impact on your A1C.
Got it.
So I will often counsel people around Christmas time, if you can push that A1C off until February instead of January, because it may be artificially high in January because of what just happened. And then sometimes you'll get the A1C, it's like, I don't understand why it's high. Had a woman, 92-year-old woman from the nursing home, who I was working at the nursing home, also in the hospital, and she comes in and in the hospital for a little bit, But I'm at the nursing home and I'm looking at her A1C going, what is wrong? I said, her A1C jumped 2 points in a month. I said, this makes no sense.
Yep.
And then I realized she had broken her hip and had a urinary tract infection in that 2 month period, or I mean that last month period.
Right.
And it took almost 2 months to get it back to her normal range. But it will go back down. So remember, other things affected. And that's why it's not always the best test, especially if it's borderline, to test and to diagnose diabetes, but it's a great litmus test to let us know how things are going.
We had the same thing with steroids. One of the family members on steroids, and I told them we advocated they wanted to increase medication, and I said no, there's steroids. Let's do one more A1C, and then we can compare. And the second A1C was normal.
Yeah.
So you do have to advocate. You have to show a whole picture to your healthcare provider.
Absolutely, and some medications will increase. So besides stress, illness, and infection, there are medications that increase your blood sugar, such as prednisone, corticosteroids, even statins increase your blood glucose. So because other things affect your A1C, if the A1C test is out of range, it's always best to confirm it with a second blood test, usually a fasting blood sugar.
Right.
And again, the fasting blood sugar is the last to rise. So if this is a test to determine if you have diabetes, if your fasting blood sugar is over 126, over 125, you have diabetes, okay? So, all right. We're going to continue on. And as far as the A1C, how often do you get your test done, Dawn?
Either every 3 months or every 6 months.
Perfect.
Generally, if it's routine, I just do it every 6 months.
Yep.
But Medicare will pay for every quarter.
Right. They won't do it every 31 days. I mean, every 91 days they'll do it. So don't
Yes.
try to get it done in 89 days, but they
Right.
will. So you can have that scheduled quarterly, and Medicare does cover it. And it's nice to follow. And sometimes people see seasonal trends. I often find people that enjoy hunting will have their lowest A1C in December, because they're out in the woods and they're hunting and they're not even thinking about it, and they're getting activity more so than they usually do. And your family members, do they get the A1C done on a regular basis?
Absolutely.
Good. All right. So target range for A1C, does anyone know what the target range for an A1C is?
5.5 to 6.
Okay. Dawn?
Well, I think 6.5 marks diabetes, right? And pre-diabetes is 5.8 or something like that.
Yeah, great. 5.7 to 6.4. Yep. Yep. So, so the A1C test measures your risk for long-term complications. That's the design of the A1C test. And they have done lots of research on persons with type 1 diabetes that have had diabetes most of their life, because usually it's diagnosed in childhood. Can be diagnosed as an adult, but usually the majority have it since birth, or not since birth, since childhood. And so they look at the people that have complications and don't have complications, and what is the best range to prevent complications. And 7% is the goal from the American Diabetes Association. That is their standard. That number can be adjusted. If you have really good blood sugar control, I like to see it under 6.5, like Dawn, is 5.8 to 6.1. That's awesome. Your chance of long-term complications are so low. The lower it is. Oh, and by the way, every point that A1C goes up, you have a 37% increased risk of heart attacks and stroke.
Wow.
Every point. So it goes from 7 to 8. You just increased your risk of heart attack and strokes by 37%.
Wow.
It goes from 8 and 9, another 37%.
That's
every
incredible.
point. Fortunately, vice versa, the reverse is true. So every point you lower it, you lower your risk. And it's the same with kidney disease and blindness. So that A1C test is super important to have a minimum of twice a year. I do recommend it 4 times a year if your A1C is above 7%. If it's below 7%, 2 to 3 times a year. Okay?
So what I worry about is as I get older and say I was in a nursing home, wouldn't my A1C tend to go up or my blood sugars because I would be much less active than I am now?
Yep. So great point. And and as we age, we actually produce less insulin, so
Right.
blood sugars are going to go up anyways. Your chance of long-term complications at that stage of your life probably aren't the highest priority.
Okay.
Just to let you know. So, we
Very
do
well
it.
put.
Well, we do adjust the A1C goal based on other factors like comorbidities. If you live alone, so that lady that lived
Yeah.
alone, her A1C. If we could keep your numbers above 8%, which meant her average blood sugar was around 150 to 170 most of the time when she tested, but it wasn't 30 and it wasn't 400. So and she was pretty consistent on what she ate. So
Oh,
she
okay.
had she had a pretty stable range. And yeah, but you also have to look at quality of life too. And when
Yeah.
I worked at the nursing home, they had the monthly birthday parties, and they'd have the frosted cake and the ice cream. And so the kitchen staff would leave a portion of the cake unfrosted. And the persons with diabetes, the activity gals, would say, would you like a piece of unfrosted cake or would you like a scoop of ice cream? Because both are actually about 15 grams of carbohydrate, and it's not going to be too bad. A little fat in both of them, so it's not going to really spike the blood sugar like juice would. One of my favorite residents there, I will have the frosted cake and a scoop of ice cream, please. Quality of life,
Yeah.
She looked
Oh,
forward
yeah.
to those birthday
That's right.
parties, and the nurse had to give her extra insulin that night. So that's what happened. Family members bring in sugar-free candy. By the time the family members were gone, the person's eaten the entire box, not realizing that there's unfortunately some sugar-free alternatives that may cause some gas and diarrhea down the road, but especially if you eat a whole box, so watch out for that.
Yeah.
Those sugar alcohols, if you have any GI issues, watch out. But so the A1C test is a great test to really measure your risk for long-term complications. And you do want it, ideally between 6 and 8. I really would have a hard time feeling comfortable above 8% if we're trying to avoid long-term complications. All right. Well, again, thank you both so much for being a big part of these series. I hope you at home are getting valuable information and that makes a big difference in your blood sugar control. Please don't hesitate to contact me if I can be part of your team. In our next episode, we still are going to continue on the topic of blood sugar control. So thank you again for listening, and we wish you good health.